Hello guys, welcome to Two Doctors Travel's Healthy Heart series. In this series of videos, we intend to cover topics like diabetes, hypertension, and common heart ailments like coronary artery disease. We'll be talking about the disorders and will give you advice how to stay away from these disorders. In this first video, I, Dr. Hashmi, will be talking about coronary artery disease or heart disease in general. So fundamentally, there are three arteries that supply your heart, and blockage of any of these three arteries significantly will cause symptoms of shortness of breath, chest pain, sweating on exertion. Based on the percentage of the artery blocked, the people with coronary artery disease can be classified as the asymptomatic category, wherein the patient typically doesn't have any symptoms on exertion and has a blockage of close to 50%. These patients of asymptomatic category, if there is no intervention made in the diet or the exercise, progress to the stable angina category, wherein the patient has symptoms of chest pain, shortness of breath on exertion, and typically has a blockage of close to greater than 70%. Followed by patients who are under the unstable angina category, who have a typical blockage of 90%, and these are the patients who have chest pain and shortness of breath, which is not related to exertion. These episodes are unpredictable and are random. Then comes the ST segment elevation MI category, where the blockage is 100%, followed by the non-ST segment elevation MI, where the blockage is close to 90%. The last two categories are clubbed together and are called as heart attacks. Now let me talk about what is done and what interventions are taken. Once the percentage of blockage crosses 70%, the treatment and intervention is aggressive. The first option available for the patient is surgical, that is CABG, that is coronary artery bypass graft, wherein they put in an artery from other part of the body into the heart so that the blocked artery is bypassed. The second option available, which is a bit less invasive than CABG, is angioplasty, followed by stenting, wherein they put a stent and try to reopen the closed or blocked artery. All these three interventions are done for stable angina, unstable angina, and for heart attacks. But they do not address the etiology, that is atherosclerosis, that causes the blockage of the artery. What one needs to do is work on the risk factors to prevent the probability of the person getting the heart arteries blocked by atherosclerosis. So let me briefly talk about the risk factors. The risk factors for coronary artery disease are basically classified into two: the modifiable risk factors and the non-modifiable risk factors. The non-modifiable risk factors are the factors like family history and the age of the patient, where a person who is above 45 years of age in men and above 55 years in women have a greater probability of getting the blockage. A person cannot work on the non-modifiable factors and they are fixed, but what a person can work on to modify are factors like the LDL value, which is proved to be the number one risk factors for coronary artery disease. So if you have a high LDL level, that is basically high lipid in your blood, these get deposited in the heart artery wall and cause occlusion. The second most important risk factor is hypertension. Hypertensives are at a greater risk than the general population, followed by a person who smokes, is obese, and leads a sedentary lifestyle. One of the most important and common risk factors is diabetes. Diabetics are at a greater risk of coronary artery disease over long periods of time, over years. So, what one needs to do is, if you have pre-diabetes, you can work on reversing it, and if you have diabetes, you can get serial examinations done to see if the artery has started to block. Lastly, another risk factor that has proved to be important is increased fat content in your diet. So these are the modifiable risk factors. You can work on them. You can try to reduce your LDL levels, eat less amount of fat, control your diabetes and hypertension, quit smoking. Now let me move on to what weight loss does in terms of improving your general health. Weight loss is bringing your weight down to the BMI category, that is your body mass index between 18 to 24. There are BMI calculators that help you attain such a weight. They give you the desirable weight you need to have a BMI between 18 to 23. So when you reduce the weight, your triglyceride levels go down, your LDL level goes down, your total cholesterol level goes down, and your blood pressure in general goes down. So these are the favorable changes that decrease your probability of having coronary artery disease. I would like to add in a point about the right exercise to do to benefit your heart. There are patients who argue that climbing staircase can be an exercise. Some tell lifting weights can be exercise. So what is the right exercise? The only exercise that benefits your heart is the exercise wherein you exercise for 150 minutes a week, and these are divided into 30-minute sessions for 5 times a week. These 30-minute sessions should have 20 minutes workout and 10 minutes rest. During the 20 minutes, you need to achieve a heart rate of this value, that is 220 minus age and 75% of this value. So you need to have this heart rate for 20 minutes to benefit your heart on the long term and stay safe from coronary artery disease. Not just exercise, you need to work meticulously on your diet so that your fat content consumption is low. I will be making a separate video on the best diet to follow to have a healthy heart and overall general health. Lastly, I will be giving you few tips so that you can follow up on your protection from coronary artery disease over years. What one can do after exercising and also consuming the right food is follow up on your lipid levels each year. You can do a lipid profile and bring down and maintain your values that I'll be giving now and follow them up. And in case the values increase, you need to address them by proper exercise and diet so that you bring down the weight of your body. And if still your lipid values don't go down, you need to start medication, before which you need to consult a physician to do that. So the values that are suggested are a triglyceride level below 150, a total cholesterol level below 150, a LDL level below 100, and a total cholesterol to HDL level below 3:1. You need to take all measures you can to keep your lipids under these values. What I would suggest is, in case your lipids are high, you need to go consult your physician before you start any kind of diet or weight loss plan. Because a lot of people have comorbidities and other medical conditions which need to be evaluated before you start exercise or any weight loss plan. Thank you for watching. Hope you enjoyed the video and liked the content. I would request you to share the video and like it. I will be making further videos on diabetes and hypertension, and also the right kind of diet one needs to consume. I'll be covering few diets and what benefits they bring in. Thank you. See you in the next video.